Let's talk about histrionic personality disorder. People with histrionic personality disorder have an unstable emotions and distorted image and an excessive need to be noticed, like they want to be the center of attraction or center of attention within a specific space that they find themselves. This condition usually affects females more than males, and it usually starts in their teens to their early 20s. With some of the causes, one is parenting style. My dear parents, if you indulge your child so much, you put him or her in such situations like this. Some, they don't even care about them. They don't care about their physical well-being or emotional well-being. And children, when they are in that state, want validation. They want people to see them also. If my mom or my parents are not seeing me, the outside world should also see me. When the child does something, you can actually praise the child, but be moderate about the way you praise your children. Akwadaa bi apɛ mo, nti ne sɛ woka sɛ akwadaa no wayɛ ade a, you have to be mindful of how you are saying it. And then you have to also be mindful of how you don't pay attention to the emotional needs or psychological needs of your child. Some parents tend to display their love before their children and without putting boundaries on these kind of display. So you show the erratic side of your relationship before your children. My dear, in as much as you think you are doing them good, you are actually doing them bad. You are fixing them in situations like this. Another cause is also childhood traumas. If you neglect your child, I said it earlier in the parenting style, you put the child in such a situation. If you abuse your child physically or verbally, you are giving her out to some of these things. Some children also go through emotional breakdowns when they lose their loved ones. It can be parents or those children who were raised by grandparents or caregivers who were so good to them. Genetics can also be a factor. Some families have histories of personality disorders that transcends to children as well. Let's go to the symptoms. They begin to feel depressed or unappreciative when they are not the center of attention. Everyone's attention has been shifted to what they see as not needful or not important because they are supposed to be important at that particular time or at that particular moment. They begin to feel depressed and then unappreciative of whatever that is going on there. They are dramatic. They are attention seekers and extremely emotional when expressing themselves. They can be dramatic and expressive to the extent that they will embarrass you. Whether you're a parent, whether you're a family member, or whether you're a friend, they can embarrass you with their expressions, with their drama. They are persistently flirtatious and charming. So, see, one thing about histrionic people is they dress provocatively or seductively just to get the attention of people. This is because they use physical appearance to draw attention to themselves. You know, they have this rapid mood switch, and that is where they will end up embarrassing you. And they are looking for instant gratification, consistent or constant reassurance and approval that will make them feel that they belong or they are worthy of wherever they find themselves. For the effect, due to the way they are, because it can be embarrassing with the way they dress, with the way they talk when they are in public. So they are unable to maintain relationships, be it family or friends, because they are seen as fake and shallow in their interactions. They are seen as unprofessional in their appearances and then their utterances. They have this inability to cope with failure and losses, which results in them falling into anxiety, depression, and sometimes they are suicidal. They end up engaging in substance abuse. They are unable to sustain jobs due to boredom and frustration. They don't have that energy to take in some of these frustrations and then boredom. They will just move. Panic attacks, especially when they are expressive. It's actually the panic attacks that makes them become this dramatic in expressing themselves. Let's look at the treatment. Personality disorders are usually difficult diagnosing because the people who are having this condition don't even want to accept that they have a condition in the first place. Most of them, they are diagnosed after 18 years. Histrionic is one of them. They mostly go to their physicians with anxiety and depression, problems. Some of the therapies that they are usually recommended for is psychotherapy. It is to help them uncover the motivation and then fears related to their thoughts and behaviors, and also help them to learn how to associate with people properly. They usually go through group support where they get people who are also going through some personality disorders. And usually what is helpful is when they meet group of people who are having the same condition. It helps them understand that they are not the only ones going through it. Also, they take them through psychodynamic therapy where they focus on the root cause of the problem, the patterns, consistent things that has gone on in their relationship that resulted in the breakups, the number of losses in a particular situation, the repetitive things that they did or happened during that time, and then the supportive psychotherapy. It aims at helping the person with coping mechanism or the coping skill, and also it helps in restoring the self-esteem or self-worth of the person. Another therapy that they are recommended for aside the psychotherapy is cognitive behavioral therapy. For the CBT, it helps them to take a closer look at their thoughts and emotions, and helps them to also unlearn some of these things that distresses them or puts them in distress. Thank you so much for always watching. Please don't forget to like, share, and subscribe. I'll be very grateful. Do take care of yourself. I'll see you some other time. Bye.